What is this orthopedic oncology? Most of you people might be thinking that what is this orthopedic oncology? We have never heard about it. A lot of the even the orthopedic surgeons wonder, is there a separate branch called orthopedic oncology? Orthopedic oncology means it's a branch or a subspecialty in orthopedics which deals solely with bone tumors. Now, how many people? Your next question is where all do we have these kind of centers in India? I should say that these kind of centers or these kind of people are not more than 10 to 15 people in India who practice orthopedic oncology solely. Now, in our center in Sunshine Hospital, we have a specialized unit for orthopedic oncology headed by me, and we deal with all kind of benign, malignant, metastatic tumors. So today's topic, I'm going to talk on a bird's eye view about bone tumors and how we approach bone tumors and what are the possible things that we can do in bone tumors. Traditionally, when in the past, what used to happen is that whenever doctors used to see a bone cancer patient, they used to just amputated. They used to just cut off the leg and tell that this fellow is anyway going to die. Now, in the past few decades, probably past 20 or 30 years, this perception has changed, and with the advancement in the treatment of bone cancers or bone tumors, it's possible to save the leg and also save the life if the patient is brought in an early stage of the disease. So that's about the bone tumors. Now, next question is that what are the types of bone tumors? Now, any kind of tumor means there is a growth which is not normal. That's called the bone tumor or the tumor. Now, the tumors are of two types. One is benign tumor, second one is malignant tumor. What is benign tumor? Benign tumor is the one which is usually in one particular place and it doesn't spread or kill the patient. Now, what is a malignant tumor? Malignant tumor is the one which starts in one place and through blood or through lymphatics it spreads to other places and ultimately it kills the patient if not treated. So these are the two basic different types of tumors. Now, again, these there are a lot of gray areas. Some tumors may not come into benign or malignant. Something in that in between. Also, what are the different types of malignant tumors? Next question is the different types of malignant tumors. It can be a primary malignant tumor or a secondary malignant tumor. What are primary malignant tumors? When a tumor or cancer arises directly from a bone or soft tissue, it's called a primary malignant tumor, primary bone or soft tissue tumor. And if from a different place it spreads to the bone, it's called as secondary malignancy. Now, say a patient with breast cancer or a prostate cancer or a thyroid cancer, these cancers can spread to the bone and leads to pathological fractures or deformities or cripple the patient in the stage 4 disease. So these are called the secondary malignancies. So that's about the type of tumors. Again, that's basically about the types of tumors in the way how they come. And again, histologically we change, we classify the tumors into some tumors which produce bone, some tumors which produce fibrous tumor, or some produce cartilage, or fat producing tumors, or the ones which are produced in the bone marrow. So these are the different classification systems. Again, I'm not going into detail about this because this itself is a big topic per se. So next question is that what is the age group which is common for these bone tumors? So bone tumors are more common. Again, this answer will depend upon are we talking about the benign tumor or malignant tumor. So more focused or more important thing is a malignant tumor, so I'm just going to divert my attention towards the malignant tumor. So malignant tumor usually has two peaks. First is the first 2 decades of life, that is within the first 20 years, or later on after 50 years of life. So what are the cancers which are common in the first 2 decades of life? They are something called Ewing sarcoma, then osteosarcomas are very common in the first 2 decades of life. And after 50, cancers like multiple myeloma, chondrosarcoma, or the secondary or metastasis, what we call it as, those are very common after 50 years. Even though I have told you that these are the common age group that these cancers come, but they have a overlap, and we do see a lot of patients in the whole age group spectrum. So that's about the age per se. And next, coming on to the symptoms, how do we diagnose that the patient has a bone tumor? Now, a lot of patients come to me saying that the patient was having this problem, and they went to a general physician, and he told that it is a growth pain, and they neglected it, and ultimately the patient has come out with stage 4 disease. So this is quite a common occurrence. So I would suggest anyone who has got when a child is complaining of some kind of pain, to go to a proper orthopedic surgeon, and then get a proper digital X-ray done, and then if any iota of doubt is there, then come to a specialist, and we can do the needful. So the pain now. Again, the pain is one factor which brings the patient to us. If it's a common occurrence that if the swelling or the tumor is there in soft tissue, the pain is not much. But in bone, the pain is usually there if it is a cancer. This is because